Did you know that neurological conditions affect 3.6 million Canadians living in the community and 170,000 Canadians living in long-term care facilities? The National Population Health Study of Neurological Conditions was the largest of its kind ever conducted in Canada. This study was a partnership between Neurological Health Charities Canada, the Public Health Agency of Canada, Health Canada, and the Canadian Institutes of Health Research. The goal was to close the gaps in the information available on neurological conditions in Canada. We wanted to gain a better understanding of the impacts of neurological conditions on Canadians and our healthcare today and over the next 20 years. According to projections, by 2031, the country's population is expected to grow to 40 million, with close to 25% of the population aged 65 or older, compared to 15% today. Because many neurological conditions are seen in older people, it makes sense that the number of new diagnoses will rise over time. In 20 years, the number of Canadians aged 40 or older living with Alzheimer's disease or other dementias and Parkinson's disease is expected to almost double. However, traumatic brain injuries are projected to be the most common neurological condition in 2031. A traumatic brain injury can happen to anyone, such as with a fall. Alzheimer's disease and other dementias and epilepsy are expected to follow in ranking. The study shows a pattern that links a projected increase in the number of people with neurological conditions to a rise in healthcare costs and caregiving requirements from family and friends. Over the next 20 years, it is projected that total annual health sector costs for Canadians with neurological conditions will increase, doubling for those with dementia and Parkinson's disease. Depending on the condition, healthcare costs for Canadians with neurological conditions will be $0.6 to $13.3 billion greater than healthcare costs for Canadians without these conditions. If innovations in care, prevention, and treatment could reduce healthcare utilization by Canadians with neurological conditions to be similar to those without these conditions, a substantial amount of resources could be used to meet other needs. Currently, many family members, friends, and neighbors provide informal care to people living with a neurological condition. This need for caring is expected to continue and will likely increase over time. Let's reduce the burden of neurological conditions in Canada. Visit mybrainmatters.ca for more information on the study's findings or about neurological health.